It's so painful. My knees can never go away.
Let us start off with epidemiology of dysmenorrhea. Dysmenorrhea, which is also known as period pain, is now as the most frequently reported gynecological concern among women. It impacted around 60% to 93% of school-age girls in various studies. It also impacted women across reproductive ages, with approximately 10 to 50% of women enduring severe menstrual cramps, and also disrupt their routine daily activities at home. Dysmenorrhea can be differentiated into primary dysmenorrhea and secondary dysmenorrhea.
Please come in. Hi, afternoon. Is it upstairs? So, what brings you here today?
For the past 2 to 3 days, I've been experiencing pain, especially on my lower abdomen and also my calf. But however, today I feel like it gets worsened, probably because it's my first day of period. And at the same time, I also feel a little bit of headache and nauseous.
So, based on the symptoms, I think you are experiencing primary dysmenorrhea. So, I will prescribe you some painkiller first. But if your symptoms persist, please do come again and visit me. At the same time, when you go back, you can drink a lot of warm water, and you must avoid some spicy and cold food.
Pain women experience alongside the menstrual flow, which is not linked to any underlying medical condition that might have caused it. It is basically caused by hormones produced during the menstruation, which are important in aiding, coordinating, and regulating the menstrual flow. These hormones are called prostaglandin and are produced by the uterine muscles in order to initiate the contractions of the uterus, important for the uterus to shed its lining. Now, who might be experiencing primary dysmenorrhea? Generally, women under the age of 30 are the ones experiencing primary dysmenorrhea, but there are far more unique characteristics to women with primary dysmenorrhea, such as women who started menstruating before reaching the age of 12, women with heavy menstrual flow or irregular menstrual flow, which is not easy to predict when it's going to start or going to stop. So what are the symptoms of primary dysmenorrhea? These symptoms are things that I'm very sure women are familiar with or have experienced before, such as the burning sensation around the pelvic area or the lower abdomen, pain around different parts of the body such as the back or the thighs, or pain starting around the time you are expecting your menstrual flow, which is going to intensify until it reaches its peak at 24 hours after starting your menstrual flow. Moving on to the other phase of dysmenorrhea, known as secondary dysmenorrhea, which unlike the primary type is actually caused by an abnormal issue. Hence, secondary dysmenorrhea or uterine pain is a complication of an underlying medical condition which might occur inside or outside the uterus. So what are some of those medical conditions? Basically, those medical conditions are caused by presence of glands and stroma outside the uterine cavity or inside the middle lining of the uterine wall. It could be also caused by overgrowth of the uterine tissue. Now, who might experience secondary dysmenorrhea? Basically, women over the age of 25 might experience unique characteristics such as smelly or whitish discharge, pain during intercourse and PA, or abnormal bleeding accompanied by enlargement of the uterus or asymmetrical enlargement of the uterus. So what are the symptoms of secondary dysmenorrhea? Of course, the burning sensation around the pelvic area or the lower abdomen is going to persist and will occur with secondary dysmenorrhea. Some of the other symptoms are going to be abnormal bleeding or abnormal discharge or even infertility. So how is primary dysmenorrhea diagnosed? Basically, dysmenorrhea is diagnosed by a healthcare provider where the patient in question is going to be given the space to talk about their concerns and symptoms, after which the caregiver will carefully assess the patient's medical history because it's a very important step in evaluating painful menses, along with investigating the efficacy of standard therapy in elevating or limiting the presented symptoms. Now, some of the information that the caregiver will be seeking is going to be the location, the duration, and the characteristics of the pain, as well as the first appearance of pain. While on the other hand, secondary dysmenorrhea is going to be diagnosed when there are symptoms indicative of secondary dysmenorrhea or when the standard therapy are not effective. So the healthcare giver will then recommend for further examinations. Now, some of the symptoms indicative for secondary dysmenorrhea is going to be late appearance of pain after a long history with no pain, usually after the age of 25, or basically when the physical examination results are abnormal. Now, some of the available pelvic examinations that could be carried out are going to be ultrasound, MRI, or rectovaginal examination. So the aim of this examination is to actually assess the activity of the reproductive system via analyzing the images generated via the examinations or the devices.
Now, I'm going to introduce two OTC drugs for dysmenorrhea. One is aspirin and another one is paracetamol. As the non-steroid anti-inflammatory drug, this medication helps to relieve menstrual pain. They function by inhibiting the production of prostaglandin as they block the action of cyclooxygenase, which is an enzyme responsible for synthesis of prostaglandin. Taking pain relief medication 1 to 2 days before onset of period and continuing for the initial 2 to 3 days menstruation can be effective in alleviating cramps. However, there are some side effects for aspirin. One is gastrointestinal side effects such as nausea, vomiting, and diarrhea. The other one is it has risk for renal and cardiac failure on prolonged use. We should know that women with a history of gastroduodenal ulcer, gastrointestinal bleeding, or perforation should likely explore alteration treatment functions. Paracetamol, which also known as acetaminophen, it is one of the most popular used analgesic and antipyretic medication in the world. It is used to treat patients who are not suitable to use non-steroid anti-inflammatory drugs, such as those with bronchial asthma, peptic ulcer disease, hemophilia, salicylate sensitized, children under 12, and pregnant or breastfeeding women. It works as pain reliever by having a central analgesic effect which is mediated through activation descending serotonergic pathway in the brain. Well, it also has side effects such as allergic skin reaction, enhanced previous liver damage, and it also may cause higher prevalence of digestive tract ulceration during combination with traditional non-steroid anti-inflammatory drugs. Long-term application of paracetamol will also cause renal functioning disorder, high blood pressure, increasing in prevalence heart infarction, and hepatic failure.
Now, before the end of the video, let's take a few quizzes about this topic. The first question is it safe for individuals with asthma to take aspirin for pain relief during menstruation? Yes or no? What do you think? The answer is no. Aspirin is a non-steroidal anti-inflammatory drug, therefore it will cause bronchospasms, acute asthma exacerbation, and also severe asthma morbidity. Therefore, asthma patients should not take aspirin to relieve pain. Alternatively, they can take paracetamol as OTC medications for dysmenorrhea. Let's move on to second question. Can we turn herbal remedies as an alternative treatment for dysmenorrhea? Yes or no? Ding! The answer is yes. Herbal remedies can be used as alternative treatment. However, a healthcare provider must be consulted prior to administration because of not all herbal remedies are safe to consume, and the doses as well as the potential side effects need to be aware and considered. The last question is, does engaging in every form of exercise worsen menstrual pain? Yes or no? Tene, the answer is no. We can actually try out moderate intensity aerobic exercises like yoga, light jogging, or walking during lighter menstrual days. This type of physical activity can actually reduce bloating and help us with our blood circulation, as well as the release of endorphins, the feel-good hormones, which can act as natural painkillers for dysmenorrhea. These are the references for our video. That's the end of our video. We hope this video has provided you with better understanding about dysmenorrhea. Thank you for watching.